Hi and welcome back to another video. It's lucky you found me, actually, because today I'm looking for some advice, your advice. Even though I'm asleep, I'm dreaming about an experience I had as a junior doctor. Maybe it's a nightmare. I'm hoping you can help me make sense of it, help me decide what the right thing to do was. It's a quiet day. I'm pleased I finished the ward round early. I'm just laying back in the residents' quarters, sipping a tea and doing some study. Well, sort of. Anyway, just as I'm enjoying this welcomed lull in the day's work...
Attention please, Code Blue, Ward Dawson, Bed 4. Code
Ward
Blue,
Dawson,
Ward
Bed
Dawson,
4?
Bed 4.
I know that bed. That's my patient. I rush to the ward. In my mind, I run through the possibilities. A false alarm? Maybe he's tripped and fallen over, and all I have to do is a quick check for any bruises, hopefully no bones broken. As I push through the crowd, I'm wishing for that false alarm, but my wish is not granted. In fact, it's the worst. That thing no doctor likes to see. It's an arrest.
We have an 80-year-old man found unconscious. His name is Mr...
It's Jones, Mr Rupert
Is
Jones.
your patient? Yes, right. Excellent. Well, we need your input. He's not breathing. He has no pulse. How bad is his dementia?
Maybe it's because I'm in a daze, but the question takes me by surprise. A, B, C, D. That's the mnemonic for resuscitation. That's airway, breathing, circulation. But I'm sure the D doesn't stand for dementia. I answer automatically. Why?
Why? Well, isn't it obvious? Should we resuscitate this bloke or stand down the Code Blue?
I begin to feel the pressure of 1,000 fat medical textbooks closing in on my head. I hear what they're asking, but I'm not sure of the answer. Should we be resuscitating this man with dementia? And I begin to wonder. I know you can help me, so let me explain the question. As Mr Jones's doctor, they're asking me whether this man should be resuscitated. If you're outside of the hospital and you come across a cardiac arrest, well, that's a different situation. There's no question, if you don't know the person, you're going to start CPR. You'll do your best until the paramedics arrive, but in hospital, it's a little different. Knowing the patient and knowing the possible outcomes, we're in a position to make a decision about whether we'd go ahead. Why? Because just as we have a duty to act for the benefit of the patient, we also have a duty to do no harm. And resuscitation is not a walk in the park. It's a serious, invasive intervention, and sometimes, when the outcomes are not likely to be good, it may be better not to put the patient through it. As the treating doctor, Mr Jones is my responsibility. Today, the buck stops with me. So I bring you back to the question, should we attempt to resuscitate this patient? Mr Rupert Jones? Mr Jones, the father of 2 children, grandfather of 8. Mr Jones, a war veteran and a former university professor. Mr Rupert Jones, a man with dementia. It's a hard question. We may not have the answer, but we do have some other information. Let's start by looking at Mr Jones's medical situation. He's 80 years old, lives alone at home and has sugar diabetes, an irregular heartbeat, had a stroke 3 years ago, and is on medication for high blood pressure and cancer of the prostate. I admitted him to hospital for treatment of a bladder infection. The infection made him confused and he needed some time in hospital just to get him back on his feet. I planned to send him home in about a week's time with some extra help from the council, but we're a long way from home now. I'm not sure how it's come to this for Mr Jones, but I suspect his heart has stopped because of metabolic imbalance from the infection, and so now he's not doing so well. But how is Mr Jones usually? When he's not lying on the floor without a pulse, that is. Well, he's not running marathons nowadays, that's for sure. In fact, he uses a walking stick. He has osteoarthritis in his knees and hips, but he still gets around okay. Occasionally drives to the shops on his own. He does a bit of cooking, mainly reheating the Meals on Wheels, and looks after himself with a nurse dropping in to check his medicine and to help him out with a little showering. His heart and lungs are not as they used to be, but good enough to keep him going for another few years at least. Then there's his head. Well, his brain actually. Well, that's a tricky one because, as I said, Mr Jones has dementia. and that complicates things. For one, we know that people with dementia do not recover as well or as quickly as others from a new illness. The chances of a successful resuscitation are lower than for the average person. Dementia is also considered a terminal illness. It's not something we can cure, and it usually gets worse with time. The dementia will also make Mr Jones's quality of life worse as time passes. On the other hand, dementia as a disease is not black and white, it's a spectrum. Not every patient with dementia is the same. In fact, some people with dementia may be vastly different. Sure, Mr Jones has short-term memory problems, but his old memories are fine. In fact, you might say he has a mild dementia. He's mobile, by and large looks after himself without much help. And as a former professor of literature, he still reads avidly. He enjoys spending time with his grandchildren when they come to visit every week with his son's family. Okay, so there's a bit about Mr Jones, but we're still stuck. We need some advice, and everyone has an opinion. I can already hear their voices.
Life is precious. They may be different to you and I, but people with dementia can still enjoy their lives.
If you resuscitate someone and they end up worse than before, that's doing harm to the patient.
It's not for doctors to play God and decide who lives or who dies. If there's a chance something can be treated, then you should treat it.
But if treatment is absolutely futile, all we're doing is putting the patient through pain.
What's the point of having one of the best health systems in the world if you're not using it for everyone's benefit?
A good health system needs to distribute resources to where we have the greatest chance of making a difference to people.
Distribute resources? Doctors shouldn't put a value on the quality of life.
Doctors are cruel when they don't assess quality of life and put patients through futile treatments that leave them lonely, depressed, and incapable.
All right, just one at a time. So we know there are a lot of opinions. But what opinions am I supposed to consider? The ones that matter? Well, obviously, there's Mr Jones. He should have the final say. He can't give us an answer now, but in the past, well, that's not clear. Some days he's told me how he's waiting for his 90th birthday party and for his great-grandchildren to be born. Other days, when he's especially lonely at home and frustrated with pain from arthritis stopping him walking, he's told me he wishes he could just slip away peacefully. What about Mr Jones's family? His daughter wants us to do everything. She's been visiting him every day and insisted he's really happy. Every moment I have with Dad is precious, she says. His son, on the other hand, has an opposite opinion. There's no way my father would want to risk being in a nursing home, especially if he had brain damage after resuscitation. It's not worth the risk to do anything, he says. So who should I listen to? What if I don't agree with them? Am I compelled to do something I don't want to do just because they say so? I find myself thinking, I wish the situation was simpler. I just want to hide away and let someone else make the hard decision. I wish I had got there either 10 minutes earlier or 10 minutes later. 10 minutes earlier, I could have asked Mr Jones to work it out. 10 minutes later, someone else would have already made the decision. I come back into the fleeting moment. No hiding from the answer any longer. That ICU doctor, why are they always so calm? Maybe because he's asking me to make the decision. And so I'm asking you, tell me, should we do it? Should we attempt to resuscitate Mr Jones? Would he want to be resuscitated? Is it in his best interests? Is it medically justified? Is it a justifiable use of our health system resources? I close my eyes, take a deep breath, and give my answer. I'm Joseph Ibrahim. Thanks for watching this video.